Hi, good afternoon, everyone, and good afternoon to you, Dr. Faiz. Thank you for joining us on this wonderful day, and we sincerely appreciate you taking the time to share with us the importance of understanding and being aware of cervical cancer. To be very honest, it is quite interesting to see two men on screen talking about cervix. But as a son and a husband, I hope from this session I could learn a thing or two about how I can care for my loved ones. So thank you for giving us the time. So now for our viewers and followers out there, you have an interesting background, Dr. Faiz. You graduated from the University of Manchester. You did your training at the East Lancashire Hospital and moved to one of Europe's largest treatment centers, the Christie NHS Foundation Trust, but decided to return home in 2014. You were in Sarawak. You did a lot of talks about cancer, and you're now a resident doctor at MAKNA, the Majlis Kanser Nasional.
Mhm.
So, if you don't mind, sharing with us a little bit about, why you're such a huge advocate of for cancer, so that the audience and we could get closer to what really motivates you in doing so. Yeah.
Well, thanks for having me, Alan. I think cancer is such an interesting subject because you have this almost newish, keyword that's probably never been heard of like the last 50 years, and there's always new research coming in about cancer. So in cancer we always say never. You'll never say, oh, we can't do this, we can't do that, because there's always something new that we learn about in cancer all the time. And the most interesting fact to me about cancer is how easy it is, especially in terms of certain cancers, and especially true for cervical cancer, it is to prevent cancer and to detect cancers early. Yet, this is something that we don't do, especially in Asia, especially in Malaysia. So that's why I'm very passionate about talking about these issues, especially cervical cancer, because it's so easy to prevent and to detect early.
Okay. So then, I guess then, thanks for highlighting that topic, right? Like, so then to help us understand better, so what is cervical cancer?
Well, for I suppose to start with that topic, you have to understand what is a cervix. A cervix, or in Malay we call pangkal rahim, is actually the opening of the womb. So if you have the woman's uterus or the womb, below it is 2 to 3 centimeters at the end of the womb is the cervix, and then the cervix opens to the vagina. So it essentially is a part is a muscle that differentiates your womb from your vagina. So if you have a cancer of your womb, it's called endometrial cancer or uterine cancer. If you have a cancer of your vagina, it's called a vaginal cancer. But cervix, such a small part of your body, 2 to 3 centimeters long only, yet it causes a lot of cancers. It's the ninth most common cancer in Malaysia. It is the third most common cancer in Malaysian women. So such a small part of your body, the cervix, yet it's the third most common cancer in Malaysia. It affects about 4,000 Malaysian women in the last survey that we did. Roughly about 800 new cases of cervical cancers diagnosed every year in Malaysia. So it's such a small part of the female anatomy, yet it is such a very important cancer to talk about.
So, okay, this is quite a heavy topic. I think just the introduction alone, that information, suddenly I feel overwhelmed. Uh, uh, so I mean, drawing from my own personal experience, right? My wife and I, we are expecting, and we went through birthing class. So we also went through this course to understand the female anatomy a bit better, so that we also understand uh, what we're getting into, right, in preparation for the birth. So we were also learning about the female organ, right?
Mhm.
And now that you mentioned this, right, I was trying to picture. It's like, okay, where do I place the visual and try to understand what we're talking about? So let's say we take it slowly now, just to help me to understand this much better, because you mentioned uh, it's a small part of the body. 4,000 over women would have experienced this. So if we could just kind of break it down part by part, what are maybe the different stages of cervical cancer? Or yeah.
I think it's when we talk about any cancers in general, it's very important to know about the staging of the cancer. But even before knowing the staging of cervical cancer, we have what we call precancerous lesions. These are things that we can detect very early. What this means is that there are cells in your cervix that actually show signs of changing into a cancer, but they're not cancerous yet. So these cells can be detected up to 10 years early before they develop into full-blown cancer. And that's why we do pap smears. So before we talk about the staging of cancer, there are staging of precancerous lesions. And this is what we detect through cancer screening. Now, when we talk about cancers in general, we have what we call early stages, which is stage 1 and stage 2, and later stages, which is stage 3 and stage 4. Now, the survival, as usual, is usually highest in the earlier stages. In stage 1 in particular, the chances of survival is very high. When we talk about cancers in general, especially in Malaysia, we always think, oh, people will always die of cancer. There's nothing that you can do. I have cancer, I will die. But this is not true, especially in early stages, in stage 1 and stage 2, and even in stage 3, the chances of survival is very high. In cervical cancer, for example, if you are detected in stage 1, your 5-year survival can be as high as 90%, 95% even. But unfortunately, if you're detected in stage 4, your 5-year survival, we call it, is only about 20%. And chances are you will die when before 6th or 7th or 8th year. So that is why it's very important to detect cancers in general very, very early.
And
now,
to
when we talk about cancers also, unfortunately, in Malaysia, 40% of all cervical cancers is detected at a later stage, i.e. stage 3 and stage 4. This is so different compared to when I was working in the UK, where only a handful of cases are detected in stage 4 onwards. Sorry, in stage 4. Because we don't have the screening program that they do in the UK, in Malaysia. For example, in Malaysia, most cases of cervical cancers are detected at the age of 50 to 70. It peaks at about 70 years old. But in the UK, most of my patients were detected at age 25 to 45, and these are through screening processes. So the most important thing when we talk about staging is that the lower the stage, if it's stage 1 and stage 2, the higher the chances of survival. And in order for you to detect cancers at an early stage, you need to look for it. You need to screen for these cancers.
Thank you, doctor. And I think a lot of us don't think too much about cancer screening because we don't think of ourselves as trying to hit that lottery, right? And you mentioned just now there were some interesting stats. You were saying that a lot of them were during the early 20s, 20 to 30. So
yes, in the UK, it's detected quite early, between 20 to 40 years old.
So how do we raise this as a conversation with the women, right? Because one part of the question is also about because cervix relates to the relates to the reproductive system. And you mentioned that at the age of 20 to 40, they would have detected it in the UK, a lot of them. So how should a female think about maybe planning for a screening? Why is it important? Has it to be related to the fertility?
So when we talk about cervical cancer and fertility, there's always two branches of it. A, whether the cancer itself affects the fertility or whether the treatment affects the fertility. So because cervical cancers often present in women of childbearing age between 20 to 40, this is such a hot topic issue. So we always think about this when we treat the patient. So cervical cancer on its own rarely causes fertility issues unless in later stages when it destroys the ovaries and the female hormones. So then it causes fertility issues. But in early stages, it rarely causes fertility issues. Now, treatment for cervical cancer, for example, might cause fertility issues. Radiotherapy might destroy your ovaries, which produce your female hormones. So it might cause early menopause, whereby you can't have any more babies. Chemotherapy, for example, might suppress a lot of your reproductive functions. But as soon as you stop chemotherapy, sometimes your reproductive function will return. So it's not a big problem. And the most important thing in terms of cervical cancer treatment is the surgery. Any cancers, if we can cut it out, we will cut it out. So that is why it's very important to detect cancer very early, especially cervical cancer, because if detected in early stages, we can spare the uterus or the womb. So you can still have your babies. We can after you've had the surgery, but if detected in a later stage, we might have to remove the whole womb and you have nowhere else to grow your baby. So when it comes to fertility and cervical cancer, the cancer itself rarely affects fertility, but the treatment can affect the fertility. But the earlier you diagnose the cancer, the better the chance of your fertility being spared.
So on that topic, I think that's a very important point. When it comes to cancer, we should try to screen as early as possible so that we can address them. And you mentioned an important thing, which is it's not about the screening, it's about the treatment, right? Then then the next question I have is structurally, step by step, to if let's say I put myself in a woman's shoe, how should I reduce that risk? How can I reduce my risk of cervical cancer?
Right.
What are some things I can do?
Yeah. So this is so for you to know how to reduce your risk. First of all, you need to know what are the risks of cervical cancers. What are the risk factors of you getting cervical cancer? The number one cause of cervical cancer, and this is true for almost more than 90% of all cervical cancers, is HPV infection. So persistent HPV infection, human papillomavirus, is present in more than 90% of all cervical cancers. So that is the number one thing. HPV, there's about 80 different types of HPVs, but only about four HPVs that accounts for about 90% of all of the cervical cancers, right? So that is why we have HPV screening, we have HPV vaccines to stop you from getting cervical cancer. So the number one thing that you can do to stop you from getting cervical cancer is to know your HPV status, because the number one risk factor is persistent HPV infection. The number two risk factor for cervical cancer, surprisingly, is having sex with men. So lesbians have a lesser risk of getting cervical cancer, because unfortunately men tend to be a bit more promiscuous. So, and HPV is sexually transmitted disease. So the more sexual partners you have, the more you have sex with men, the more the men have sex with other women, the more your chances of getting HPV. So the number one risk factor of cervical cancer is HPV, and HPV is present in about 80% of all sexually active individuals, and they might not even know it. So that is very dangerous. So the number one risk factor is HPV. Number two is sleeping with men. Number three is sleeping with men with multiple sexual partners. So that is the number one thing, the number one risk factors for for cervical cancer.
I think this awareness is good. Then I guess from a female standpoint, then we know what are the things to look out for and assess. And if we were to think about these three factors that you mentioned, and I'm aware, and then now I decide that actually I feel a bit uncomfortable, or maybe like I'm a bit worried about, because maybe I encountered these three, then what are the available screening tests that I should do, or how should I go about it? So okay, I know I need to go test it now just to be sure.
Right.
What's available out there?
Okay, so it's so easy to detect. It's so easy to detect cervical cancer early. Like I mentioned before, we can actually detect cervical cancers up to 10 years in advance. We can prevent your cervical cancers from happening up to 10 years in advance. It's just by one easy swab every 3 years. So I think a lot of women know about the Pap smear test. It's where you go to see your doctors, and then your doctor will take a swab of your cervical area. It's just like a cotton bud that you would do a COVID test, but instead of doing it in your nose, they'll just put it up your vagina and just have a little twiddle in there and on your cervix. If you're not comfortable with a male doctor, you can request for a female doctor. If you're not comfortable with a doctor, you can request for a nurse to do it. And it's not that hard. It's only 5 minutes every 3 years. So within these 3 years, if we detect anything, we can treat it. And usually, if you are regular with your screening and you do it every 3 years, we can detect cervical cancer even before it becomes cancerous. So that is why screening is very important, because we can detect it 10 years in advance and we can stop it from actually becoming cancer. But unfortunately, in Malaysia, it's not a program that is, we don't do this screening as a population-based screening. So when I was working in the UK, if you are of age, my computer will automatically call you up, send you an SMS and send you an email saying, okay, you are of age. Please go to your doctor to get this done. 3 years later, my computer will send you another reminder. But in Malaysia, we don't have that system yet. So it is really up to the individual patient to recognize that, hey, you know what? I've had sex with a guy before. I don't know what he was like. I need to know my status. So I need to take care of my own health, and I need to go see my doctor every 3 years to get this done. Because cervical cancer, remember, ladies, it is the number 3 cancer in Malaysia, and it affects about 800 people a year. And there's no reason why anybody should get cervical cancer, because we can detect it so early.
And when you mean, Dr. Faiz, when you mentioned that it's so easy to detect the results, right? What kind of results do we expect? Like when we look at it, how do we read the different levels or thresholds or severity?
Okay. So when you, like I said, it's like a COVID test, whereas the COVID test, you just take a cotton bud and put it up your nose. But instead of that, we take a cotton bud and we take a brush and put it up your vagina and into your cervix. And then a week later, you'll get the results. The results are basically looking at the cells of your cervix, whether there's any changes to a normal healthy cell. So if you have a normal healthy cell, then we'll say it's okay, don't worry about it. Come back in the next 3 years and we'll check you again. But if we see some changes to your cells that, hang on a second, this doesn't look quite as healthy as a normal cell, we'll call you up again and then we'll say, let's have a look and investigate deeper into this. So it's just whether your cells from your cervix looks normal or looks healthy or not.
Understand. And so the moment you detect even a slight change, you would already start monitoring.
Yeah, we know that the changes grow very slowly. For it to become cervical cancer, it usually takes at least about 3 to 5 years. So we'll monitor it from what we call stage 1, pre-cancers, not even cancer yet. So stage 1, a little changes to the cell, and then it becomes stage 2, and then it becomes stage 3, and then we'll say, maybe we need to remove it before it becomes cancerous. So that's why it's always good to screen yourself for cervical cancer, because we can detect even precancerous changes before it becomes cancerous, and we can remove those precancerous changes.
Understand. So it seems to be quite sensitive, and I guess the good thing is that it develops slowly, which means we have plenty of time to detect it early. So one of the audience actually, one question I see here, they ask, actually some of the doctors they encounter do advise them to screen annually instead of 3 years. But now they understand from you, it takes a while to develop. As long as you're doing it more frequently, you do it as early as possible, we can already start monitoring. So then the question is, do you suggest that we do annually, or 3 years is good? What's your opinion about that?
Actually, 3 years is a generalization of what you should do if you're normal and you continue to be normal. However, the actual recommendation, you need to do it once a year for the first 2 years. If you are then found to be normal, then you can subsequently have yourself tested every 3 years. However, if in any of these investigations, in any of these smears, your doctor found some irregularities, or there are risk factors, for example, you have family members with cervical cancer, or you have other members with multiple cancers, for example, then your doctor might think, hang on a second, we might want to increase your cervical cancer screening to yearly. So if you're healthy, if you don't have any other risk factors, then yes, you can get yourself tested every 3 years. But if your doctor advised you that they found some changes or they found something that they are concerned about and suggests to do it every year, then I would follow that doctor.
Understand. Now, I wanted to segue into the treatment, but before that, I wanted to understand, like, is age a factor, right? Expanding on the question here, is this because we factor in age? There are also audiences who ask then, if you're older, if you're after 60, does that mean you need to? Do you need to do more frequently, perhaps in the test, for example?
Right. Well, age is always a factor in terms of any cancer, because cancer happens when your cells accumulate a lot of damage. So as you grow older, your cells do accumulate more and more and more damage. So that's why when you talk about cancer, any cancer in general, you see a lot more patients in the older age range. So, and this is true for cervical cancers as well. The more your body is exposed to the HPV virus, or the longer the HPV virus is in your body, the more damage it causes to your cervix, and the higher your risk of cancer. So as you grow older, yes, you do get more and more cancers. So that's why in Malaysia, for example, you see the graph growing exponentially like that, with the least number of cancer diagnosed at a younger age, the highest at about 70 to 75. The only reason that the highest incidence of cancer is detected between 20 to 40 in the UK is because we have a good screening program. But if we leave it to the natural course, then the higher you are, the older you are, the higher your risk of any cancer, cervical cancer especially. And Kamala asked, after 60 years old, do you need to do pap smear? So in all honesty, the guidelines from the UK has said that after 69, you can stop doing pap smears. This is only because after 69, our age range is usually no more than 80, and cervical cancer is such a slow growing cancer that it's less of a concern after that. But usually we say after 69 you can stop doing your pap smears, but only if your previous pap smears are normal and your doctor thinks that you don't have any other risk factors.
Right. Now, you also brought up to the fact that in Malaysia, right, because a lot of people may not be aware, and it's not like a national drive to call us up for doing such tests. Then the question is, for a shy Asian, being in our culture, but for a female at a young age, are there telltale signs for you to kind of trigger us to, you know what, it's time that I maybe do a test?
The thing with most cancers is that we try not to wait until there are symptoms, because the symptoms for cancer is very insidious. We rarely get to detect cancers at an early age, and usually when symptoms already appear, it's usually at a later stage. Especially with cervical cancer, the symptom is usually spotting or pain during intercourse or after intercourse, or bleeding post-intercourse. And a lot of women just think, you know what, this is normal. Maybe I've had rough sex, or maybe this is like remnants of period blood. So a lot of women tend to just ignore this. So I would rather not everybody rely on symptoms in terms of detecting cervical cancer, and just follow the guidelines of please doing your pap smears every 3 years and to detect it early, and please even prevent it. try to reduce your risk factors, try to reduce the numbers of your sexual partners, try to get vaccinations early.
Now, on that word, right, vaccination, then I wanted to kind of segue to then treatments, right? If we were to found there are some anomalies, what are the kind of the next steps, right, towards treatment?
Once we detect your cervical cancer, you can talk to your doctors about your treatment options. Please don't be afraid of your doctors. We're very friendly. I don't think any doctors mean harm to you. And you can talk to us about everything and anything and the sun. Talk to us about your concerns. If you are of childbearing age, you're still not finished completing your family, talk to us saying that you want to continue to have kids. What are the options for that? But usually for any cancer, the first step is always surgery. If we can remove the cancer, we will remove the cancer from your body. And then it's a combination of chemo and radiotherapy. Radiotherapy is very easy. A lot of women think it's difficult, but it's actually just about 5 to 10 minutes a day, however long you need to do it. And then you don't even have to stay in the hospital. You can just go home and come back on a daily basis. Chemotherapy is something of an issue in Malaysia because a lot of people think chemotherapy is so scary. People die from chemotherapy. I will lose my hair, But the thing is with chemotherapy is that we have babies as young as 6 months old having chemotherapy. I have a patient who's 95 years old who has chemotherapy. So really, if you are 40, you're 20, you're 30, you're fit enough to have chemotherapy, don't worry about it so much. If you have any symptoms from your chemotherapy, talk to your doctors. We can give you a rest. We can give you medication to help you with the symptoms. We can reduce your dose if we have to. So the best thing to do is just talk to your doctors, clearly hash out everything from A to Z. We will take all the time you need. We're not going to force you into any treatment. The decision is yours at the end of the day. So just talk to your doctors about your surgery, your chemo, your radiotherapy options, and just think it through. Don't rush into it. Cervical cancer especially is a very slow-growing tumor. We're not going to say, oh, we need to start your treatment tomorrow. We'll usually say, take 2 weeks, take 3 weeks, think about it, come back to us. Don't worry about it.
Now, Doctor, when you mentioned radiotherapy, surgery, first thing in the top of my head, it feels a bit intrusive. Like it's very, very serious surgery, right? Are there, if you want to treat it even much early on, because you mentioned that the main factors to cervical cancer is caused by HPV, then are HPV vaccines then effective in preventing cervical cancer?
Okay. So HPV causes about 90 to 95% of all cervical cancers. So it's actually very good. So vaccinating yourself will protect you against 90 to 95% of all cervical cancers. Automatically, there's a magic pill essentially that can reduce your risk for this type of cancer by 95%. And it's not a difficult vaccine to take. It's been in the market for several years. I've taken it myself. Yes, men can take HPV vaccine as well. And for 3 vaccinations, for 3 injections over the period of 6 months, it can protect you against 95% of all cervical cancers. I think the Kementerian Pendidikan Malaysia have started vaccinating schoolgirls, 13-year-old girls in school since 2010. So if you've missed that, if you're older, for example, and you haven't received your vaccine, and you're not yet in a committed relationship. So if you're still in the dating pool, you haven't ended up with your Prince Charming, or if you need to get your vaccines. I always say, please protect yourself. Yes, you trust your boyfriend. Yes, you trust your husband. But at the end of the day, it's your own body. Please take the initiative to protect yourself against HPV. If you're in a committed relationship, if you think that your husband will never, ever cheat on you, then it's fine. Don't take it. But, if you have doubts, just protect yourself.
Understand. So So the key advice here is take the vaccine, build
Yes.
whatever immunity you can at the early on. Be responsive to yourself and take the test so that you're also aware. And then consult your doctor to get the best advice on what the next step is. Now, if the person unfortunately does develop cervical cancer, how important can palliative care help?
Yeah, I mean, again, when you talk about cervical cancer, when you talk about a lot of cancer in general, a lot of people think, okay, I have stage 4, I'm going to die from my cancer. What's the use of going to a doctor? Why should I go seek treatment? But even if your doctors can't do anything else to cure your cancer, there's a lot of things that doctors and nurses can do to help you with your cancer. Palliative care is not about curing the cancer, because we can't do that anymore when it's already stage 4. But what we can do is we can delay the progression of the cancer. We can delay it from growing bigger, further. We can delay it from spreading to your lungs, to your kidneys, to your brain. So there's a lot more things that doctors and nurses can do in terms of palliative care. And the major thing that we do in palliative care is controlling your symptoms. And with late stage cancer, for example, pain is the number one symptom that a lot of cancer patients complain about. A lot of people think, okay, it's just pain. There's some Panadol, there's some ibuprofen, and that's it. But I will tell you right now that cancer pain is the most excruciating pain you will ever experience in your life. If you are having a heart attack, 10 milligrams of morphine is enough. If you are giving birth, some Pethidine is enough. But I have cancer patients who are on 60 milligrams of morphine, plus ketamine, plus gabapentin. It's still not enough. So pain is something that we can help you with. And there's a lot of other complications of cancer as well, like kidney failure, bleeding, urine problems. So these are things that we deal with in palliative care. Your nurses can help you with, your doctors can help you with, your home care nurses can help you with. And beyond the physical, we can also provide you some emotional and some psychosocial support. Because by using palliative care, you can actually give your carers at home some respite. It's not easy being a carer. So by the 2 hours that a home care nurse come and help you at home, it gives the carer at home some much needed help. By the one day that you are admitted in the hospital, perhaps, your children or your husband who's taking care of you at home gets a much needed rest. So it's not easy having cancer, and it's not easy taking care of cancer patients. Allow doctors, nurses, home care nurses to help you with that, to shoulder some of that burden as well.
Yeah, I think in order for us to fight that journey towards recovery, it's important that we try to muster as much mental strength, be in the best condition possible, to be able to go through that healing. That's a very, very good point, Doctor. Right now, the biggest topic in the market right now, or in public, is that COVID is a big thing, and everyone is waiting for their turn for vaccines. However, even I myself sometimes wonder, if let's say I am going through certain treatment and I'm a cancer patient, I'm going through treatment, let's say cervical cancer, for example, is it safe for me to go for my COVID vaccination jab?
Okay. So in terms of COVID vaccinations and cancer treatment for any cancers, and cervical cancer inclusive, if you are currently on chemotherapy or radiotherapy or any medication that might suppress your immunity, you need to consult your individual doctors first, because there are certain medication that you cannot take or that you can take while you take your vaccine. But if you have stopped chemotherapy, if you stop active treatment, radiotherapy, for example, you're a cancer survivor, then it's absolutely fine for you to take your COVID vaccine. It's absolutely safe. I've taken 2 jabs myself, and all of my colleagues have taken the jabs, and so far, touch wood, nothing's bad happened. So please, if you have the ability, if you have the chance to get vaccinated, please do.
We have another question. So from the audience related to this, if they've already done surgery, they survived that first stage, what are the chances of recurrence? If I'm a cervical cancer survivor, I've recovered, what are the chances of it being recurring?
With any types of cancer, the chances of recurrence is always there, and the chances of recurrence are highest in the first year, and then it tapers off exponentially as you grow, as you get through the years. And so that's why it's very important for you to undergo regular doctor checkups. That is also why in the first year we follow you up every month, and then in the second year every 3 months, and then after that we follow you up every 6 months, because the chances of recurrence is always there, especially if it's diagnosed at the later stage. Because the later your cancer is diagnosed, the harder it is for the doctor to remove 100% of the cancer. So the chances of recurrence is there. It's higher if it's diagnosed at the later stage, and it's highest in the first year. So that's why you always have to be more monitored more closely in the first year, less closely in the second year, and so on and so forth.
There was one question here, interestingly, from the audience also asking this, because we talked a little bit about prevention, and now we're talking about how do we handle the recovery journey, and what can we do to try to stay and monitor and prevent, right? There was a question earlier on, we mentioned about HPV vaccines. Why is it important for men to also get the HPV vaccine? Because you kind of alluded, you kind of mentioned men a little bit as a culprit, one of the top 3 reasons, right? So could you share your thoughts on that?
Okay, so men, I'm talking to all the men in the audience. Let's face it, it's so easy for us to get sexual partners nowadays. Previously, you have to go out on a date, you take the bus to the I don't know, post office in town, and then meet the girl there, go out makan. But now all you have to do is just DM somebody through Instagram or swipe left and swipe right on Tinder to get your next sexual partner. Everybody now has a lot of sexual partners. So women, please be wary of men. If they say that, oh, you're my first, you're my only one, they're lying. You're not their first, you're not their only one. And men, you need to take the vaccine because you need to protect your future wife. You need to protect your future partners. And men, and HPV doesn't just cause cervical cancer. It actually causes 6 different types of cancers. It causes oral cancer, esophageal cancer. It causes anal cancer if you do anal sex. So HPV also causes anal warts and cervical and genital warts. So with the cervical vaccine, you protect yourself against all these unsightly warts, but also you protect yourself against 5 different types of cancers. And for men, also you can protect your future partners against all these against cervical cancer. So not just women need to take it, but men, if you have the chance, if you have the money, if you have the ability, please take the cervical cancer vaccine as well. It protects you against 5 different types of cancers. It protects your future partners against cervical cancer, and also it can protect you against genital warts as well. If you don't know what it is, please Google up genital warts, and trust me, you will get the vaccine tomorrow.
Got it. Thank you, Doctor. I will take a couple of questions, some more questions from the audience before I conclude with my last question. So now we're building, I think that among the audience, they're building up some knowledge and awareness now, and they're being very, very curious. First question I want to take from Miss Mei Ching. Her question was whether, if a pap smear result were to show any thickening, or I'm not sure what hyper means in this case. She's worried about whether, is there a high chance of getting it right? But I guess consulting the doctor will be the right thing to do. What is your opinion for this question?
Well, pap smear results, usually they come up with grading. Like, for example, a mammogram will tell you it's BIRATS 1, 0, 1, 2, 3, 4, 5. With pap smear results, they usually will tell you it's CIN 1, 2, or 3. So from there, your doctor will advise you whether you need to be monitored more closely or whether you need to get treated for it to prevent it from becoming cancerous. So I'm not exactly sure what it means by thickening or hyper, but depending on, if you look at the piece of paper, again, they usually will tell you whether it's CIN 1, 2, or 3, and your doctor will be able to advise you accordingly, whether you either need to be monitored more closely, do a repeat pap smear in a year's time, do a colposcopy test, or whether you need treatment.
And I have another question. So this with the name KNS LPPKN when Takap, the person asked if HPV DNA test is tested positive with type 16 or 18, but when doing colposcopy the result come back normal, is it okay? So I guess it's two different tests, and
Yeah.
the results come back kind of normal, and you're not quite sure how to interpret it, I guess. How would you advise going about this?
Well, let's talk about the two different tests. I mean, there's two different tests. KNS, or Jan just mentioned HPV DNA, which is one test, and then I've mentioned pap smear, which is the second test. HPV DNA, as the name suggests, only tests for the presence of HPV, but it doesn't look for the presence of cervical cancer changes. So pap smear, you have to go to your clinic, you have to baring on a katil, kam besar, and the doctor or the nurse will take a swab, make sure that you don't have cancer. HPV DNA test, the beauty of it is that you can do it yourself. We give you a cotton bud with a very long tip, like you do with the coronavirus test. You go to the toilet yourself and you perform it yourself. So you don't have to have a doctor or nurse with you to do it for you. So if you're embarrassed, you can do the HPV DNA test. However, the HPV DNA test does not tell you whether there's cancerous or not. Even if you don't have HPV in your system, you still have to go for your regular pap smears. So even if you have vaccinated yourself against cervical cancer with the HPV DNA vaccine, you still have to go for regular pap smears. So if the HPV DNA tests positive with 16 or 18, which are the highest risk factors for cervical cancer, but your pap smear result comes back normal, it's okay for now, but you are at a higher risk for cervical cancer. So you talk to your doctors, and your doctors will usually advise for you to get a pap smear regularly, usually every year from then on forth. Because when you are already positive with type 16 or type 18, you have a higher risk of getting cervical cancer. So that is one of the reasons why another doctor will advise you to get pap smears more regularly.
Right, thank you.
But don't worry about it. It doesn't mean that you will get cancer. The chances of you getting cancer is still quite slim, but you are at a higher risk compared to the rest of the population.
Right. I'll take one more question as the third one. Nine just posted this. Her question was, is there any finding or research for oral chemo tablets to take for cervical cancer? I guess that's her question.
Okay, so thank you for the question. We, unfortunately, right, most chemos that we have right now is via IV. We have to, stick you with a needle and give you a course of chemotherapy through a tube. For Xeloda is the only oral chemotherapy agent that we have. It's commonly used for a lot of cancers. But in terms of what you use for chemotherapy in terms of cervical cancer, there's a variety of chemotherapy agents that we can use for cervical cancer. So speak to your doctors about it. I don't think we use Xeloda very, very regularly for cervical cancer. And in terms of tamoxifen, it's something that we use regularly. It's not a chemotherapy agent. It's a hormone blocker. It's an estrogen antagonist that we use in breast cancer. So we don't use it regularly in cervical cancer. So, what I don't want people to be bogged down about is what can I do in terms of the treatment? What treatment is best for me? I mean, when you do get the cancer, please talk to your doctors. Please iron it out. But what I want you to take away and what I want you to remember is that cervical cancer is so easily detected, so easily treated. Don't worry about what you do after you get cancer, but focus more on what can I do to prevent cancer from actually happening to me.
On that note, then, are there what are the typical common myths that are associated with this? Right, I mean,
okay.
People think a lot about
when you talk about cancers, for example, a lot of people think, oh, I cannot prevent cancer, but actually, cancer is highly preventable. With breast cancer, for example, just exercising 30 minutes a day, jogging or brisk walking 30 minutes a day can reduce your cancer risk by 55%. Smoking causes 11 different types of cancer, not just lung cancer. So by quitting smoking or removing yourself from a secondhand smoking situation reduces your cancer risk greatly. And especially with cervical cancer, getting vaccinated reduces your risk by 95%. Screening helps detect cancers early, up to 10 years, prevents it from becoming cancer. So cancer, especially cervical cancer, is highly preventable. Another myth about cervical cancer is that if you have HPV vaccine, you will definitely get cervical cancers. Again, that's not true because it's a complete myth. Usually, your body is adept at clearing up and killing off the viruses. Coronavirus, we kill it off. HPV, our body kills it off. We don't need any treatment. However, in some individuals, their bodies are not able to kill off the viruses. So the viruses keep recurring, and your cervix gets the damage. Accumulative damage causes a cervical cancer. It does not mean that if you are HPV positive, you will get the cancer. Only in certain individuals, they will develop the cancers.
Then what about...
Sorry, what was that?
Sorry, before I interrupt, maybe I'll let you continue.
Oh, no. And the lastly is like we mentioned before, I've received the HPV vaccine, so I'm protected against 95% of all cervical cancer. So I don't need Pap smear test. Again, that's not true. Regular Pap smear test is still necessary for those who've had the HPV vaccine because the vaccine only protects against 95% of all cervical cancers, but not the 5%. So there's still that risk. So it's such a small test, 5 minutes every 3 years to protect yourself against it. So even if you've had the HPV vaccine, please get your regular Pap smear test every 3 years.
Got it. Thank you. Then does that also then mean there's a question from Sarah in the audience? Then what about, can fibroid lead to cervix cancer if no surgery is done? Like, is that also a cause?
Well, fibroid, you don't get fibroid on the cervix. You actually get fibroid in the uterus. So fibroid, if you want to think about it, you might want to think about uterine cancer or endometrial cancer. But the risk of these benign tumors, like your cyst, like your adenomas, fibroadenomas, like your fibroids becoming cancerous, is actually very, very low. It's less than 1% or 2%. So if you do have fibroids and your doctor says, okay, it's benign, don't worry about it. So usually if you have something like a cyst or like a fibroid, your doctor will monitor it more closely. We would normally say, okay, let's repeat your test in 6 months' time. Make sure that it's not changing or it's not growing. If it's not growing, if it's not changing, and a doctor says, oh, everything is fine, you don't have to be worried about it, then don't worry about it. The risk of them becoming cancerous is very, very low.
All right. I just want to go back to the question around the HPV vaccine, right? And you did advise that vaccination doesn't mean 100% immunity. At the end of the day, we still need to do the Pap smear test to be sure. However, when it comes to the HPV vaccination, how regular should we take this? There was a question from Alice, do we need to take 3 of this for a whole life, or is something we need to do every 3 years or every 5 years regularly, like a routine?
Right. So the beautiful thing about the HPV vaccine is that so far we know that the 3 injections that we take in the period of 6 months will protect us against the individual viruses for the rest of our lives. You don't have to have booster shots like you do with hepatitis vaccines, or you don't have to take it annually like you do with flu vaccines. So just the 3 vaccines over 6 months will protect you for the rest of your life. It's not cheap. I'm not going to lie. The cheapest one that we have is 800 ringgit for 3 shots. The most expensive one is 500 ringgit per shot, so 1,500 ringgit for 3 shots. But at the end of the day, it's for the price of, I don't know, a Coach handbag for a woman, and it will protect you against 95% of all cervical cancers for the rest of your life. So please, if you have the money, go get it. If you don't have the money, if you can, please save up to get it. We don't offer it in the government sector because it is very expensive, but you can go to private clinics or even Path Lab or BP Lab to get it done.
Okay, I think I will take one last question, and then maybe we can end this session with Dr. Faiz sharing with us what are the one thing you really want us to remember as we take away, right? So the question I want to help ask is, what are the symptoms or early signs of cervical cancer?
So what was the question again?
What are the symptoms or early signs of cervical cancer?
Okay. So in terms of cervical cancer, the first symptom that normally come is vaginal discharge. But this varies greatly in the amount, and it can be continuous or it can be intermittent. It can come and can go. Number 2 is bleeding. This can be spontaneous, but it can also occur after sex or after urinating. And the third symptom is vaginal problems or vaginal discomfort. So anything wrong with down below, please go get yourself checked. If you think that anything is abnormal down there, please don't ignore it. A lot of women ignore it. A lot of cervical cancers we detect at the later stage because women ignore the symptoms. A lot of ovarian cancers, especially, we detect at stage 4 because women have these symptoms for months and months and months and they ignore it. So anything down below that you find that's not normal for you, go see a doctor and go get it checked.
All right. Thank you, Doctor, so much for sharing with us. There was a lot of good insights. Actually, you got me thinking a lot about people close to me, and I do want to share this knowledge that you have given. To close off, could you share with us what are that one key reminder that you cannot stop repeating and you want us to take away from this session?
Okay, so if you remember one thing, just remember that cervical cancer is highly preventable, and you can do this by 3 ways. Number 1, get yourself vaccinated. Number 2, get yourself screened every 3 years. And number 3, just do not trust men. Simple as that.
All right, the last one is a bit tough. So thank you so much, Doctor, for again giving us your time and sharing with us your knowledge around cancer and helping us to really understand this from all different perspectives. And prevention in this case is something definitely easy to prevent. And to close off with everyone, to our viewers, I just want to share that whatever information that we provide today is to help build that general knowledge for all of us. Is purely educational. It's never to substitute any professional health advice. So do seek your medical advice for your medical condition with your doctor. Go to the nearest health institution to get assistance. And this video only represents a view and our understanding and our knowledge around cervical cancer. So with that, thank you very much, Doctor, and thank you for viewers and all your questions, and thank you for tuning in. Thank you very much, everyone. Bye.